As you may know, October is Breast Cancer Awareness Month. That's why you see a lot of people wearing pink this month. This morning, we're taking a look at the alarming rise in breast cancer cases among women under the age of 50. Now, a recent study shows an almost 8% increase in diagnosed cases over the 10 years to 2019. Breast cancer is the second most common cancer in women in this country and the second most common cause of cancer death for American women. Our Christina Ruffini spoke with a 38-year-old woman who tells us about her shocking diagnosis and how she says it had gone undetected.
Do you see any birds right now?
Stephanie Gerard is many things. A grad student, a mother, a new homeowner.
What was a bigger shock to the system, the actual chemo or the fact that you were having to have it at 38?
I think probably having to have it at 38.
Now, she's also a woman with cancer.
When you start treatment and you look in the mirror and you're like so sad and so depressed that you're losing your hair. And then on the flip side, you're like, what is hair? Who cares? All I care about is life. I want to live. I want to watch my daughter grow up.
Gerard has a family history of breast cancer and a genetic mutation that puts her at higher risk. For more than a year, she says she also had persistent pain in her left armpit and breasts. Doctors ran annual sonograms, even a breast MRI, but found nothing.
They always said, you don't need a mammogram until 40. No mammogram, you're fine, you're fine, you're fine. They've said it's normal. My doctor said cancer doesn't hurt.
In May, she saw a new doctor who ordered a mammogram, which came back positive for low-stage breast cancer.
The radiologist told me, no, this doesn't show up on a breast MRI because these are microcalcifications that can only be picked up by a mammogram.
So you needed the mammogram.
So you needed the mammogram.
She also needed a double mastectomy.
When I found out that I was going to have a mastectomy, I thought, like, I want to remember my body like the way it was. Sorry.
No.
I want to remember my body the way it was. And so I had put out onto Instagram, if anybody knew a photographer.
That's gorgeous.
Thank you. Thank you.
In her head, this is how Stephanie still sees herself.
That's my hair. Yeah.
Hair and boobs.
Yep.
With a mane of dark waist-length curls and her pre-op curves proudly displayed. She gave us emphatic permission to show the unedited photos, but we blurred them for the sake of morning TV.
Have you thought about taking them again when you're done with this whole process?
I have. It's still my body. It's just got some battle wounds.
Following the procedure and subsequent tissue testing, Gerard's cancer was upgraded to stage 2 ductal carcinoma, an invasive form of the disease that spread to her lymph nodes. She now needs chemo and radiation.
You have to make screening earlier. Like, by the time what if I had waited till I was 40?
Yeah.
If there is something in the back of your mind telling you this is not right, then you have to push for it any way that you can get that test.
Whatever it takes, she says, to be around, to watch your kids grow up.
Every moment I look at my daughter, it's like I'm trying to hold on to every moment. I just want to know I'm going to be okay, I'm going to be here, I'm going to watch her grow up.
Oh, Stephanie, you look great. I would have taken those pictures too. She gets her third round of chemo next week. Her doctors will rescan her in a couple of months to see how the treatment works. She says she is hopeful. She's looking forward to spending the holidays with her family. She's also very excited to get back to grad school in January. Stephanie has a lot to do. For more, let's bring in CBS News medical contributor, that's Dr. Celine Gounder, who's editor-at-large for public health at KFF. Good morning to you, Dr. Celine. Is her story an anomaly? It sounds like she did all the right things. She alerted people, I feel something, and still they didn't find anything right away.
We are seeing breast cancer rates increasing among women under 50.
Why is that?
Well, there are a number of different reasons. One, women are delaying having children until later in life, until their 30s or 40s, and that is associated with an increased risk of breast cancer. We're also seeing
It is
the delay, and then also increased rates of obesity, overweight. What many people don't realize is the fatty tissue actually produces estrogen, which is why people who are overweight, man or woman, will have larger breasts. And then finally, we think some environmental factors are at play here. So the combination of those three seem to be driving more breast cancer in younger women.
But what's the downside to getting a screening earlier? Why is that not even just a normal thing for everybody?
The field is really moving away from age-based screening to risk factor, so family history, genetics, which Stephanie had both, which were indications to have screening earlier. And I think one key message, if there's anything I would get across today, it's that people need to be sharing family history with each other. You know, we all know family members who are estranged, they're not on speaking terms, maybe they're a little shy about sharing those personal medical details, but that information can be life-saving because that's how doctors know what extra tests to be getting.
I still want to know what's the downside, though, to getting it earlier. Why wouldn't I, if I have the option, why wouldn't I do that?
Well, because when you get a mammogram or, you know, other testing, especially in younger women, you have denser breasts, it's going to mean a lot of extra biopsies. And biopsies are not risk-free, and those can be, you know, scarring, et cetera. I don't think you want all these 20, 30-something-year-old women ending up with unnecessary biopsies.
It's false. You get a false
positive. Yeah.
Dr. Gounder, can you help clear up what women should be looking for when it comes to breast cancer screenings? We heard Stephanie talk about pain. I recently had a friend also who felt pain and then was diagnosed positive with breast cancer. So, but pain, you say, is not really an indicator. So what is an indicator?
So when women have breast pain, it's almost always due to hormonal changes, hormonal shifts during your period, during pregnancy. And so that keeps going, right, regardless of whether you have breast cancer or not. And so I think it can be easy to confuse that as a symptom of breast cancer. But what we're really looking for are a mass. If you have skin changes, it could be like rashy skin changes or dimpling of the breast or bloody discharge from the nipple. Pain very occasionally can be a symptom of breast cancer, especially if it's one-sided and if it's localized, not the entire breast. But usually it's not a symptom of breast cancer.
Stephanie isn't the first woman to say that she felt dismissed by her doctor. What advice do you give to those that need to advocate for themselves a little bit more?
Yeah, and this is not an excuse, but I think a lot of doctors feel like that I Love Lucy episode where it's the conveyor belt with the candies where she's trying to keep up, right? And I think sometimes doctors don't pause enough when a patient brings up an issue. And so what you need to do is, you know, if you feel like you're being dismissed, bring a family member, bring a friend whose entire job is to advocate for you, to say, you know, hold on, we need to talk about this more. And if you still don't feel heard, get another doctor.
Ask the
Second
questions.
opinion.
Stephanie said that the doctors told her cancer doesn't hurt. Is that true?
That is true. By and large, cancer, breast cancer is not, breast pain is not a symptom of breast cancer. But again, a mass, skin changes, rashy skin changes or dimpling, or breast nipple discharge, those are really the three symptoms you want to be looking for.
All right, Dr. Gounder, thank you very much. Some great information there.